They were told they were safe, inside white walls, sterile rooms, and under the care of doctors who had sworn to heal. No harm was supposed to come to them. At least, that was the promise. Hospitals are places people turn to at their most vulnerable moments. When they are in pain, afraid, and desperate, they surrender control completely to others. That is why hospitals are seen as symbols of absolute trust. But history reveals a different truth. Some patients entered these buildings seeking treatment and, unknowingly, became part of experiments. They did not know what they were being exposed to. They were not told what substances they were given. The risks were not explained. And in many cases, consent was never obtained. During the mid-20th century, especially throughout the Cold War, the line between medicine and national security began to blur. Scientific progress, military advantage, and geopolitical fear were often used to justify almost anything. Some hospitals continued to operate publicly as places of healing, while behind closed doors they became research grounds. Patients were guided with phrases like routine treatment, new medication, or experimental therapy. In reality, some of these procedures carried severe consequences. Some caused long-term physical damage. Others left irreversible psychological scars. What makes this even more disturbing is who was targeted. Many of these experiments were conducted on people who were already vulnerable. Psychiatric patients, the chronically ill, those who had little social power and no voice. There was no one to speak for them. And when the truth finally surfaced, it was often too late. What you are hearing is not speculation. These are documented cases, survivor testimonies, and facts later acknowledged by official investigations. And this is only the beginning, because the most unsettling question has not yet been answered. Who authorized these experiments? And why did no one stop them? Inside operating rooms, trust becomes absolute. When a patient is placed under anesthesia, awareness disappears completely. In those moments, the body is no longer in control of itself. Everything depends on the people standing around the table. For decades, this absolute trust was quietly exploited. Some medical procedures were presented as routine surgeries. Others were described as innovative treatments or necessary interventions. But hidden within these explanations were experiments that had little to do with healing. Patients were not told the full purpose of the procedures. They were not informed that untested methods were being applied. In some cases, they were not told anything at all. Behind surgical masks and sterile gloves, decisions were made that patients never agreed to. New techniques were tested. Unapproved combinations of drugs were administered. Unnecessary procedures were performed under the justification of research. Many of these experiments focused on how the human body reacts under extreme conditions, how much stress it could endure, how it responded to prolonged anesthesia, how the brain behaved when pushed beyond safe limits. Operating rooms became controlled environments where outcomes were measured quietly. Monitors recorded vital signs. Observers watched through glass. Notes were taken, not for patient recovery, but for data. When complications occurred, they were often explained away as surgical risks. When patients complained after waking up, their concerns were minimized. Some were told their symptoms were psychological. Others were told recovery simply takes time. But for many, recovery never truly came. Some patients experienced unexplained memory loss. Others suffered chronic pain without a clear cause. Some left the hospital feeling fundamentally changed, unable to explain why. The most disturbing part is that these procedures often took place in respected institutions, places trusted by families and communities, hospitals known for care, not experimentation. Years later, when fragments of these programs surfaced, the explanations were brief and carefully worded. Mistakes were acknowledged without detail. Responsibility was blurred. Records were incomplete or missing. What remained were lives, permanently affected by decisions made without their consent. These patients entered hospitals seeking protection. They trusted the system completely, and in that trust, they were exposed to risks they never agreed to take. This was not about a single doctor or a single hospital. It was about a system that allowed experimentation to hide behind authority. And the question that remains is simple, yet deeply unsettling. How many people were used before anyone decided it had gone too far? For years, the truth remained buried. Not because no one suspected anything, but because suspicion alone was never enough. Patients spoke quietly. Families asked questions. Medical staff raised concerns behind closed doors. But the system moved slowly, and accountability moved even slower. It was not until fragments of information began to surface that attention finally turned toward what had been happening inside hospitals. Small inconsistencies, missing explanations, patterns that could no longer be ignored. When investigations began, they did not start with clarity. They began with hesitation. Committees were formed. Statements were issued. Language was chosen carefully. Hospitals acknowledged procedural errors. Authorities referred to ethical oversights. Rarely were the words experiment or consent spoken openly. Many records were incomplete. Others had been destroyed. Some testimonies were dismissed as unreliable, especially when they came from those already labeled as vulnerable. Yet despite the silence, the impact remained visible. Former patients described feeling altered, not just physically, but emotionally. Trust in institutions was replaced by doubt. Confidence in medical authority was replaced by fear. For some, the damage was permanent. Relationships were strained. Careers ended. Lives were redirected in ways no one had prepared them for. What made these revelations especially disturbing was not only what happened, but how long it was allowed to continue. Years passed without meaningful intervention. Warnings were ignored. Concerns were minimized. In many cases, accountability dissolved into complexity. Decisions were spread across departments. Responsibility was shared so widely that no single figure stood at the center. The public was assured that lessons had been learned, that safeguards were now in place, that such events could never happen again. But the question lingered. Not loudly, but persistently. If these experiments could take place inside trusted hospitals, if vulnerable people could be used without their knowledge, then what truly separates care from control? These patients were not criminals. They were not volunteers. They were people seeking help. They entered hospitals believing they would be protected. They believed in a system built on trust. And when that trust was broken, the damage extended far beyond hospital walls. Because the most lasting effect was not physical. It was the realization that even places meant to heal can become places of harm when oversight disappears and authority goes unquestioned. And that realization still follows us today. In the end, there were no dramatic confessions, no single moment when the truth was fully revealed, only fragments, enough to understand what had happened, but never enough to bring true closure. Investigations concluded quietly. Reports were summarized. Language was softened. Mistakes were acknowledged, but responsibility remained distant. No clear faces. No clear consequences. Hospitals promised reforms. Ethical guidelines were updated. Oversight committees were announced. And life moved on. But for those who were affected, moving on was not so simple. The impact of those hidden decisions did not disappear when their investigations ended. It followed them home, into their relationships, into their sense of safety. Many patients struggled to trust again, not just hospitals, but authority itself. The belief that someone else was watching out for them had been permanently shaken. What made these events especially unsettling was how easily they blended into normal life. No alarms were triggered. No emergency declarations were made. Everything happened quietly, behind professional language and controlled environments. These were not dark alleys or secret prisons. They were hospitals, places built to heal. And that is why the damage went deeper. Because when harm comes from a place designed to protect, it reshapes how people see the world. It forces a question that is difficult to ignore. If this could happen here, where else could it happen? The people involved were not reckless. They trusted systems that had earned trust over generations. They believed in procedures, expertise, and oversight. And that belief was used against them. The story does not end with villains being exposed or justice fully served. It ends with awareness, with the understanding that power, even when wrapped in good intentions, requires constant scrutiny. That progress without transparency carries a cost. And that silence, when left unchallenged, allows harm to continue. These patients were supposed to be protected. That was the promise. And when that promise was broken, the consequences extended far beyond hospital walls. Because once trust is lost, it does not simply return. It becomes a question, one that remains.